Hello, I'm Dr. Sue Mason. I've been an energy healing practitioner for about 35 years, and I've been tasked to do a talk about healing and science for Healing Awareness Week. The reason for that is that I have a background in nursing, but also I've worked in medical and healthcare research. I was joint head of the Clinical Trials Research Unit at a university in the UK, where we used to run phase 3 randomized controlled trials, both nationally and internationally. So let me just share my screen so we can look at some slides. This short talk is based loosely on an article I co-wrote, which was published in the British Medical Journal. Just to let you know that. And if someone suggested to you that you try energy healing for the first time, you might ask, does it work? Is it safe? Are there any side effects? What illnesses could it benefit? And has it ever been tested? Well, research studies provide you with information so that you can make an informed decision about whether or not to take a new treatment. And you might not be aware, but there have been quite a few research studies about healing which look at its effectiveness. And to talk about all these is for another day, but you might like to know that the Confederation of Healing Organisations has funded a couple of studies which show the benefit of healing, and you can just go to their website to find out more about these studies. But for the medical community, randomized controlled trials are considered to be the gold standard of clinical research. Their methodology involves randomly assigning participants to different groups to test the effectiveness of an intervention, such as healing, and aims to minimize bias and establish cause-effect relationships. So what happens is that a group of people with a particular illness who receive the treatment being investigated, such as a possible new medication for this illness, are compared to a control group, which receives the best known treatment to date, or if there's no standard treatment for their illness, the intervention under study would be compared to a placebo. However, randomized controlled trials are not necessarily the best method for a fair assessment of the effectiveness of healing, and I'll try to explain why in this short talk. So, firstly, there can be a problem with sampling. Now, this involves selecting a representative subset or a sample from a larger population to study, allowing researchers to make inferences about the entire population. So the sample of people shouldn't be biased. It should be representative of the population under study. And in healing, there can be a problem with sampling. Firstly, with generalizability. Since conventional medical care is generally separate from the delivery of healing, patients recruited into a research trial from a hospital may differ from typical patients who attend for healing. For example, in their belief systems, in their coping mechanisms, and this might affect the research outcomes. People who regularly see a healing practitioner are likely to have a belief in the benefit of healing. This is referred to as expectation of therapeutic gain. If participants are aware that they're receiving healing in a trial and they have expectation of therapeutic gain, this might lead to biasing of results. This is why often in randomized controlled trials, the participants are blinded as to which treatment option they're receiving, and they don't know whether they're taking the new drug on trial or the standard medicine. So Blinding whether or not someone is receiving healing is much easier if the effectiveness of distant healing rather than in-person healing is being investigated. And people who attend for healing often do so not because they have a specific disease, although they might do, but often it's because, for example, they feel tired or they lack energy or they feel out of balance. Therefore, a trial about the effectiveness of healing based on specific disease may not have relevance. Trial treatment can also be a challenge. Firstly, energy healing has a holistic philosophy that everything is energetically interconnected. This differs from conventional medicine and presents challenges to research methodology. For example, for, say, a randomized controlled trial, healing practitioners might be asked to visit a neonatal unit to give healing only to those newborn babies who were randomized to receive healing, to investigate, say, how many hours they needed to be on a ventilator compared to those babies who did not receive the healing. All of the treatment remains the same, the only difference being that half the babies are randomized to receive healing in addition to their normal care. The philosophy that everything is energetically interconnected means that even if the healers only gave healing to those babies who were randomized to receive it, this healing energy would raise the energetic vibration in the atmosphere of the neonatal unit. And so all the babies would receive some energy healing. This could mean a reduced difference between the group of babies who are randomized to receive healing and the control group who are not meant to. So the apparent effect of the healing intervention would be reduced as all babies received it to some extent. Healing treatment is often individualized, and the practitioner is explicitly recognized as a component of the treatment. For example, it might be that more experienced healers get better results than less experienced healers. So treatment standardization within trials could be a potential problem, requiring, for example, stratification by individual healers in the randomization process. The Healing Act is not just a set of techniques, but aims to improve the client's healing process in a holistic sense. It's often difficult to retain the human experience as central within a reductionist research assessment. For example, in order to standardize the treatment being given to clients in a study, the research protocol might say that the healing needs to be of a specific length of time. However, the healer might sense that a client actually needs more or less than this specified time, and so not feel that the research protocol was appropriate for that particular client at that particular time. A way of blinding research participants as to whether or not they're receiving in-person healing is to have people pretending to be healing practitioners for the control group. These are known as sham controls, but they often provide artificial experience which distorts practice. If blinding of the treatment is not possible, there is a need for pragmatic trials with conventional medical practice as the control. Now, a pragmatic clinical trial aims to assess the effectiveness of an intervention in real-world, routine clinical practice conditions rather than under highly controlled ideal circumstances. And then also, healing is a complex intervention, and it's difficult to know which aspect helps it be of benefit. Is it the intent to heal? Is it just the highly vibrational energy itself? Is it the user's expectations, the relationship with the healing practitioner, the accompanying non-judgmental listening to the client, or or are all these aspects important? And finally, looking at outcome measures, are they appropriate? So noteworthy changes after healing, such as spiritual change or personal growth, might not be measured. Indeed, the choice of trial outcome measures may make a substantial difference to conclusions about its effectiveness. And healing, excuse me, aims to promote wellness, but also to help individuals in a process of self-healing within a spiritual and holistic view of health. For example, it may be viewed that healing can have a corrective purpose, showing the underlying disharmony in people's lives and enabling identification of areas for change. This might be the need to release suppressed anger, to forgive someone, to reduce stress by changing jobs, or becoming just more accepting of circumstances. So within this philosophy, conventional medical relief of symptoms or even cure may be considered a temporary respite if the individual does not address the underlying cause of the illness. And research therefore needs to capture the lifestyle changes which people may take when they receive healing and any resultant improvements in health. And long-term follow-up is needed for people with long-term conditions, as often there's a sort of relapsing and remitting pattern to the disease, and change is usually gradual and subtle. So over time, factors other than the fat trial treatments could bring about the observed effects. Treatment also might be effective immediately in one person, but take a few weeks for another. And trial design needs to take these variations into account. So finally, in conclusion about the problems of conducting randomized controlled trials to investigate healing, rigorous evaluation of energy healing could provide much needed evidence of its effectiveness. However, it can be argued that this research method dissects healing in a reductionist manner and fails to take account of the holistic nature of healing, leading to invalid evaluation. Researchers also need to address the complex issues in researching energy healing. Good research design will avoid invalid results and misrepresentation of the holistic essence of healing. It might be better to employ qualitative research methods for the evaluation of complementary therapies rather than the usual insistence on randomized controlled trials as being the gold standard for all health-related research. Alternatively, a qualitative study could be conducted in addition to a trial to investigate further the holistic nature of healing. People turn to healing and other complementary therapies because of frustration with conventional medicine. They often wish that the whole of themselves, their mind, their body, and their spirit will be considered in their care. Research has a challenge not to miss this holistic nature of healing. So thank you for listening.